Welcome back to IMCAS TV, 10 Minutes with Dr. Berthold Chani. Thank you for coming. Dr. Chani, you are a dermatologist with a private practice in Berlin, and the thrust of your research is in aesthetic medicine. Today we're going to talk about volumetry. What is volumetry? Can you tell us what purpose does it serve and the benefits?
Yeah, thanks for inviting me to be here. Volumetry is very important because when we age, we use volume. And now we have new fillers. We are able to substitute that volume. And that's extremely important.
And does volumetry have reconstructive uses or just for the aging process?
Well, I mean, you could think of the aging process as something that needs reconstruction. Yeah? But on the other side, I mean, we have, everybody's asymmetric, and in some patients, the asymmetry, even if they're very young, is so, I mean, visible that volumetry is a solution to help them to become more symmetric and to become more beautiful. So these two different indications for volumetry.
Aesthetic and reconstructive.
Yeah, it's both. Yeah.
Any other parts of the body besides the face where we can use volumetry?
Well, you can use it in indication. I'm not doing myself. You could do it for breast augmentation, for buttock augmentation. I'm using it for hand augmentation. I mean, for the dorsum of the hand, because this is also a very visible area when you age.
Right. And what about neck?
Well, neck you have to be difficult because otherwise, I mean, you end up having a very fat neck. So volumetry is nothing for the neck, to be honest.
Well, we're on the subject of complications. Yeah. Can you tell us a little bit about the ballooning effect and how to avoid the ballooning effect?
Well, the ballooning effect is an unwanted aesthetic effect, and I try to avoid it by having repeated injections. This is also for the benefit of the patient, because then the transition is more natural and it becomes less visible to the people around the patient. And I think that's very, very important because patients would like to be relaxed and not made up.
Exactly. And what are some other risks and complications that can be associated with volumetry?
Well, I mean, depending on the material you're using, if you get an adverse reaction and you have a lot of volume, the adverse reaction will be probably more difficult to control than for a simple filler treatment of the nasolabial folds or something like that.
What kind of complications have you seen in
Well, you get this inflammatory reactions, and I've seen a couple of cases where even abscesses develop, but this is very rare. It's nothing to scare.
Yeah.
But this is some of the risk you have to tell the patient that might happen with high volume that is injected
beforehand. And can you tell us about the cannula and sandwich techniques, and in which situations would you use each?
I mean, I think this is very doctor-driven. If I'm very, happy with a needle, I can have beautiful volumetric results using a needle. With a cannula, with these strong cannulas, you might have less bleeding.
Why is that?
Because the cannula doesn't have the sharp end, so you're not injuring as many vessels. That's the idea. The sandwich technique is just combining different types of fillers to have the augmentation effect.
On different layers?
Yeah, different layers. So you have those for very deep injections, very deep, and then for superficial. And I like the sandwich technique, to be honest, because it might give very natural result in the elderly, because then we have the volume deficiency and also a deficiency of the structure of the skin.
That's an interesting point. And I think the theme today has been combining different fillers, different methods, different techniques for the best results possible. What are the hardest areas to inject?
I think for me the hardest is to find out what the patient really wants and then to try to achieve that. I mean, the poor injection for me is not so hard because I'm experienced in doing it. There's a tough area like the infraorbital hollow for beginners, you have to be very, very careful
Right.
if you add volume there. But otherwise, I mean, if you start with small dosages, I mean, I don't see any dangerous areas.
Okay, and what are the new innovations that you see coming in volumetry techniques and products in the future?
Well, well, there might be companies trying to add something like growth factors and things like this to the fillers. I don't know which direction
Very
that's going.
revolutionary, yeah.
It could be if it works. But I think for me the future is a combination of different techniques. Yeah, and that's it. And then we have to refine our techniques and to find algorithms for the best possible combination therapies.
Yeah, it seems like the nuances seem to be making the biggest difference.
Sure. I mean, you have to combine the old and the new ones and try to get the best result for the patient.
Well, thank you so much for your expertise, and I look forward to seeing you next year.
Yeah, thank you for inviting me.